Welcome back to the Now Morning Show, where the Ministry of Health celebrates International Women's Day, choosing to put greater access and better health care for women in our spotlight on Now.
The Ministry of Health has a constant mission to ensure that all of us are in our best health and continue to support one another. And support is one thing that is synonymous with women. This International Women's Day, there is assistance coming across the board. And to talk a bit more about it with us this morning is Dr. Jeanie St, County Medical Officer of Health for Caroni, and Dr. Allana Best, County Medical Officer of Health in St Andrews and St David. Good morning, ladies, and welcome to the show.
Good morning.
Good morning.
Thank you for having us.
It's a pleasure to have both of you on the show this morning. Thank you for taking some time out. I mean, I know you're both used to these early mornings and long hours, but this is definitely probably a little bit different. And speaking about this initiative for International Women's Day, so before we get into it, tell me something. How do you feel about this initiative so far? Let's start with you, Dr. St.
I'm actually very excited about having a International Women's Day initiative and Ministry of Health being actively participating, because as we know, women are important to the building of society. Women, they take care of the family, the homes, and it's important that women don't continue to neglect themselves. And I think the Ministry of Health is really pushing and promoting for women to be included and to know that they have access.
100%. I couldn't agree with you more. Dr. Best, how are you feeling about this?
It's a wonderful opportunity for us to draw our female population closer, to remind them of the critical screening services that are available to them, to ensure that they maintain good health and sense of mental well-being.
Oh, definitely. Yes. Mental well-being also critical, not just at this time, but all the time. So let's get straight into the Ministry of Health's campaign for International Women's Day. Can you tell us a little bit more about it and what will be offered?
Sure. So through the regional health authorities, the Ministry of Health has the aim of improving access to our healthcare services. We want our women to be very mindful of all the screening services that are available to them. I know I heard you speaking about lifestyle diseases a bit earlier on. So we are aware of hypertension and diabetes. It's important to be screened. And we also want to bring to the fore screening for cancers, in particular breast and cervical cancer. These have been plaguing our women for a long time. But what is good about these cancers is that if it is caught early enough, the outcomes are so much better. And so we do want to encourage women to come out during this week of celebration to be screened.
Definitely. And, it's interesting because we spoke about, women not neglecting themselves, the importance of mental health and so much more. Do you notice a trend perhaps where women really don't take that time to go and get checked out? You're smiling, you're nodding, yes.
As Dr. St. mentioned, women are busy. We're looking after children, we're looking after older parents, and we have jobs as well. And so it is sometimes difficult to remember to look after yourself. But you have to obviously look after yourself in order to be able to do all the other things that you want to continue. And so this International Women's Day, the activities help you to ensure that you are well, both physically and mentally, to continue living life the way that you would want to.
Oh, I couldn't agree with you more there. Living life the way that you should and the way you would like to as well. Now let's talk a little about the theme, because it's inspire inclusion and greater access, which, as you mentioned, women are busy. We also do have to take into consideration that there may be those who may not have access to certain things. So can we talk a little bit about how this campaign is going to aid in actually achieving that?
Okay, so that's a very good point that you raised. So the issue of inclusion or greater inclusion, this year the RHAs are actually visiting communities, which will then bring greater access for women in terms of them accessing the healthcare. So in particular, I work in Caroni, and so the Southwest Regional Health Authority, they are actually doing, they're using the Calypsos this year actually.
Oh, interesting.
As part of their campaign. So for the Show Me Your Best Self, I am not as familiar. This Wednesday at the San Fernando North Community Center, they're actually coming out. And you all know this song are taking a mental day.
Yes, of course.
Right. So in collaboration with that, they're actually doing things like Zumba, entertainment. There'll be a health symposium, and the topics will be cancer awareness, menopause. We celebrated our first Menopause Day last year, 18th of October.
Okay.
Challenges in the elderly, they're going to be setting up booths, mental health booths, top registration, Alzheimer's Association, as well as pampering.
Okay.
So women, when they come out, you'll actually be able to get access to hairdressing, makeup, massages, which we know some of us we desperately need. So I want to encourage our ladies from the Southland, please, as part of our inclusion this year and greater access, on Wednesday, the 6th of March, which is this Wednesday, if you come between the hours of 9 and 3, you will actually be able to access those things. And on Friday, at the actual hospital, San Fernando Teaching Hospital, Level 3 conference room, there is something now for the staff. This is the staff who now work and who take care of the population via the health centers and the health facilities. They can come out for their self-care and pampering, hairdressing, makeup, nutritional education, and food sampling, right? As part of the Taking a Mental Day, which Dr. Bess has been referring to when she talked about mental health as part of wellness for women. We are not just looking at our physical health, but we're looking at mental health as well.
True. Something that can be so overlooked at many times, because they'll say, okay, no, physically I feel fine. So even if there may be, you know, some thoughts going on here, no, I'm just going to continue to push through. And we do need to pay attention to that. So we've spoken about this great event of participation, inclusion, and so much more. I know many are going to be going out for that. But let's talk a little bit about the National Screening Weekend in particular. Can you tell us why there's a specific focus on screening for breast and cervical cancer?
The statistics locally are troubling. We know that every day there is at least one woman who's diagnosed with breast cancer. And every 3 days we have 2 women dying from breast cancer.
My goodness.
In addition to that, with regards to cervical cancer, our statistics tell us that every 3 days one woman is diagnosed with cervical cancer, and every 5 days one woman dies from cervical cancer. So these are significant conditions that are impacting on our very existence, our mortality. However, it's not a bleak outlook in that screening is important. As I mentioned earlier, screening is important because if you find something early, the interventions lead to a better outcome as opposed to burying our heads in the sand, not paying attention to symptoms, and then just kind of wishing things away. We want our women to be very mindful, to be proactive, come out and be screened.
Definitely. I mean, as you say that, initially the first thing I thought was this is very alarming, but as you mentioned, once the screening is available, which we're also going to get to in a few more months, there are things that can be done. But tell us, how can we prevent cervical cancer?
Cervical cancer, we have gone through a wonderful evolution in terms of what is available. Back in 2006, the vaccine against cervical cancer was formulated. And since 2013, we've had it available locally. And so the target group is young kids. So our kids who are between the ages of about 11 and 12, parents are encouraged to bring them out to start their vaccination program. And in countries like Australia that have been implementing the vaccine, we have seen cervical cancer rates plummet. It has had a significant impact.
Okay, that's fantastic to hear, and we'll talk about where we can get those vaccines in a few moments. But let's also speak, Dr. St. Bernard, about the prevention of breast cancer. How can we prevent it?
Right, so breast cancer prevention starts even with you examining your breast. Women need to be familiar with their breasts. So breast self-examination is actually one of the first things that a woman can do in terms of screening. But also we have mammograms available and breast ultrasounds. And so what we recommend is women can go to the health centers and they can have, well, on the weekend of the screening, I believe we will be making referrals for mammograms. Examination of the breast will be available. And when women go for their mammograms, you're able to detect breast cancer, you know, much earlier than if you just did not go for the mammogram and the breast ultrasound. So those are 2 tests that are very important, and they are not as uncomfortable as they used to be in the past. I know there are women who dreaded going for a mammogram because it was painful. But now that the technology has, you know, evolved, it is a lot less painful. In fact, I would say it's painless, you know, for some of the places that you go, or many of the places that you go. So I would encourage women, and also if you're afraid, because sometimes you just don't want to, you know, face the music, as we say, get a pal, get a buddy, you know, find your tribe woman and go out there and get your breast examined and assessed. and let's find out earlier rather than later so that things can be done. And we have treatment available. We have surgery available for free in the public hospitals. We have radiation therapy, we have chemotherapy. All of these things are available for free. So if it is we do detect cancer, it is not a death sentence and oh my gosh, but it is, okay, what's the next step? And with your healthcare provider, you can have that discussion and then have access to the care.
Wonderful. So we have treatments available. We also have screenings available, correct?
Correct.
Okay, let's go back to HPV. Where are the vaccines available?
The HPV vaccines, just to backtrack a bit, so HPV is the group of viruses associated with cervical cancer.
Okay.
It's a broad group of viruses that can cause genital warts and cancer. The vaccines are effective and are available free of charge through all our primary healthcare centers in both Trinidad and Tobago.
Okay, wonderful. So we're seeing we have availability when it comes to screening, vaccines, pap smears, I would assume as well, correct? Yes. Now, who should get a pap smear?
So once you've crossed the age of 21 and you're sexually active, we would encourage you to be screened every 3 years. Again, like the breast cancer screening, sometimes people are fearful of what the process will be like. So it may be uncomfortable, but it is not painful. And it's an essential test. So we know that the infection with HPV can cause changes to the cells. If there are abnormalities detected, there are effective treatments available at our hospitals to deal with it at an early stage. And so that is why we want to push that women between the ages of 21 up to the age of 64 should come every 3 years to have their pap smear test done.
Okay. And again, as both of you would have mentioned, these things are available at our RHAs. So it's really a case of getting somebody from your tribe and going to have that support. And I'm sure when you go in, let's just say that you are in a situation where you don't have that tribe person, you will find somebody in your tribe right there in your RHA who's going to hold your hand basically and get you through it. Now, one of the things that we also mentioned in this conversation was menopause, which is something that sometimes tends to be swept under the rug. I'm not too sure why, because we all either are going through it or going to go through it eventually, right? Let's talk about the current data nationally, because we got your statistics when it comes to cancer. What about menopause, Dr. St. Bernard?
Right, so in Trinidad and Tobago, 1 in 3 women, first of all, are over the age of 45. And what we should be aware of is that menopause is an actual definition and it's a diagnosis that's made after the fact. So when a woman has stopped seeing her period for 12 months, when she looks back and says, 12 months, no period, that's the menopause. But guess what? Leading up to that period is called the perimenopause, and women may enter into that period from the age of 35 and before. And so women do need to be aware of the fact that this is something that is coming, and to be aware, and I guess even the population as a whole, I think we need to increase awareness so that people are aware of what women are going through, as we see, or what women are experiencing. That impacts on everything. It impacts on family life, on work life. In terms of the Ministry of Health, because they are very much aware of this aging population that we do have with women and so on, there was a symposium held in September last year, 2023, where they actually brought together stakeholders to discuss how are we as a country going to deal with menopause. And they actually, the Directorate of Women's Health has actually started producing literature that is available and will be available on the website.
Okay.
And it looks to things like hot flashes. We all know about hot flashes, bone health, and of course mental wellness, how the family is impacted, abnormal uterine bleeding, hormone replacement therapy. All of these things the ministry will be looking at and preparing information for women so that there is more information out there. And of course, we also have the social media platform. So I don't know if everyone is aware Ministry of Health is available. We're on what? LinkedIn, I think I've seen, Instagram,
Twitter.
Facebook. So in terms of even accessing information, you can visit the website or you can go onto the social media pages. And remember, even with regard to the mental health, we have Find the Care TT, a website that you can go to very comfortably, anonymously, and access information when looking for support. Because even when women enter into the menopause, anxiety, depression, those are issues that are real, and they can be addressed, and we do have support. We do have support.
And that is something that is so important. I'd just like to throw this one into the ring as we're discussing it, mental health, because I mean, it's a theme that resonates with all of us. But what about, not necessarily statistics, but just in general, in the positions that you hold, do you see that investment by individuals in their mental health? Or do we need to continue to, well, obviously we'll continue to push, but do we need to further enforce that drive to recognize mental health as an ongoing health issue and embrace it, essentially?
Yeah, I would say we definitely need to keep pushing and keep encouraging women to come to the fore to get support, because it's not abnormal. You're not supposed to be looked down upon. Stigma and discrimination is something that we are addressing, and we want people to feel comfortable to come forward and say, yes, I'm feeling anxious or depressed and I need support.
Definitely, something that's so important. And we see the drive happening to bring that level of comfort so people can stand up and share their truth. Dr. St. Bernard and Dr. Best, thank you so much for being here with us this morning. It's been a pleasure, and looking forward to seeing you continue to rise and support the women and men of our nation. Talking about the Ministry of Health, fantastic schedule of activities lined up for International Women's Day. Go and check them out on all social media platforms, and check us out on social media as well, because you never know what you might see. We'll be back in a few moments right here on the Now Morning Show. Okay, don't get up yet. No problem.